Thank you, Mr. Chair.
I stayed in their safe space.
A lot of the discussion tonight has been over how this bill is supposedly going to
A lot of the poor
help
who support the
sustain Medicaid long-term. And there's been a lot of talk about costs going up, but we haven't addressed the reason the costs have gone up. And this bill does nothing to address the reasons the costs have gone up. Over 50% of the costs are spent on the Medicaid population of seniors and individuals with disabilities. And it's because they have more complex
take me on.
healthcare needs.
They didn't take me on this.
A lot of it is tied up in prescription drug costs,
Stayed in their safe space.
the chronic diseases that they have. They're more expensive to treat. And yet the so-called savings from this bill are not being invested to bring down the costs of long-term care or to bring down the costs in a meaningful way of prescription drugs or to invest in the healthcare workforce at large. It's these little piecemeal, I don't even know what to call them because they're not fixes. It's like piecemeal Band-Aids
Just took care of it.
that ignore that the reason the cost of Medicaid are going up are the same reasons that the cost of health care is going up. Because of an aging population with chronic diseases. And what Medicaid expansion and the Affordable Care Act were designed to do was recognize when you have insurance, you are more likely to be connected to a medical home where you get preventative care, to stay healthy, to avoid chronic illnesses, or to get treatment early, to not have your primary care provider be the emergency room, because all of those things increase the cost for everybody else. And so I would take my colleagues at the other side of the aisle at their word when they say, well, we're just trying to make Medicaid more sustainable. If we were doing this in a bill that holistically looked at the costs of Medicaid and the cost of health care, but that's not where we are. We're doing this in the context of a reconciliation bill where congressional Republicans passed a budget plan that said to this committee, find $880 billion in cuts, not to reinvest in other programs under your jurisdiction, but to pay for tax cuts. And this bill is not being done in a vacuum, but against the backdrop of everything the Trump administration has done to cut the federal workforce, which impacts states like Virginia and their income, which shifts other costs to the states, which ties their hands on their ability to raise funds to pay for their increased share of Medicaid under this bill, while they're trying to pay the costs of every other action of the Trump administration, where you have a research hospital that's facing devastating cuts to NIH funding grants. At the same time, they're the largest Medicaid provider in the region. And I think we're losing sight of who is suffering from our inability to look at the big picture and try to tackle the problem with rising healthcare costs holistically are people who just want to know, if I get sick, I can go to the doctor and not go bankrupt. Who just want to know if I need to get preventative care, I can. And want to know if I've lived in my house, if my mother has lived in her house for 50 years, paid $45,000 for it, and then needs to go into long-term care, she's not forced to sell that house because it's now $1 million. And we're losing sight of these people in these, back and forth arguments at 4 o'clock in the morning or whatever time it is, and not looking at the big picture of how do we comprehensively tackle the cost of
Gentlelady's
healthcare?
time has
And I yield
expired.
back.